Welcome, everybody, and good to have you already. We've got close to 100 people inside the webinar. Good to have everybody. Happy summertime. Today I have my dear friend, brother from another mother, physical therapist, osteopath, acupuncturist, specializing in neuro and neuroplasticity, Alexander Bohlander from Germany, also our licensee from Northern Europe. So really good to have you with us, Alex.
Thank you. Thank you for having me. I'm very excited to share what I want to say.
Very excited to have everybody with us today. Alex, you and I both just, with our passion for movement and understanding where is the center of movement, where does human behavior exist? And then we've spent a lot of times in sort of a quest of that body, mind, spirit, awareness, mindfulness, and realizing the whole time the aspect of evidence-based neurology and physiology of the nervous system, the neuromuscular system, the map of the brain, the motor cortex, the sensory cortex, function in the prefrontal lobe. Today, we're going to be talking, and you're going to talk to us a little bit about some of the work you've been putting together. And you've been doing this for quite a few years now. I know you've gone to some training. I remember we went down to the brain training in San Diego. You've been focusing on neuroplasticity quite a bit. Tell us a little bit about what your interests are. Like, where are you putting your primary focus as it pertains to neuroplasticity, and human movement?
Right. Well, thank you, Brent. Yes, we share a long history of Pilates, working together on people that have issues with their movement skills, pain symptoms, pain pathologies. And, actually, I think the first time I came across this was when I was discussing with my daughter, Samia, who is a psychologist and a scientist, the newest research findings that she was working on during her work and during her study time in Berlin. She was working as an assistant for the Max Planck Institute, MPI, and I was seeing these patients, that all had all kinds of disorders and problems, and sometimes they were, diagnosed with a psychological disorder, but they would still see me as an osteopath. And so when I talked to Samia, to my daughter, that just got married last weekend in a beautiful wedding in Berlin. Yeah, and she was so beautiful. She has a beautiful mind and a beautiful wife. And so she said, there is so much new research out there now, and it's purely because of technology that's out there now to have functional MRIs, functional scans of the brain. And the brain was more like a dark room where, we had guesses of how and why and where, and what we didn't really know. Now there's a light in this dark room. And I think the other influence that brought me on that topic was the meditating monks that they put in the functional MRI scans, and where you see that areas of their brain was so much more active during meditation. So how can you alter your brain function, and how is your brain function different from what we thought it would be? So no localized function, but a neuromatrix, an interrelated field of electrical signals traveling in the brain. So these were the two things.
I was going to say, this morning I was listening to a webinar, of course, with Andrew Huberman, and he was talking to a neuroscientist, and he brought up the same point of 20 years ago, he didn't have access to see where dopamine goes and how dopamine, it was all a guessing game. And now they can do radioactive iodine that literally attaches to the dopamine or the neurotin or, the serotonin, and that they can see the mapping of it based on people's thoughts, activities, stimulus. And he was talking particularly about dopamine, which we've always known has been a big part of the movement and motivation center. But also he was talking about our learning up in the prefrontal cortex. That's his specialty. So we are getting really good science now that is showing how those neuropeptides and neurotransmitters are actually acting based on human behavior. And I think that's going to open up a whole new world for us of things that were, like you say, in a dark hole. Nothing can penetrate the blood-brain barrier, so you can't take a blood level of dopamine to see if you're not producing enough dopamine because you can't get it out of the blood-brain barrier. So really good stuff coming out.
So that's one part of the story. And then there was this movement coming up. So on one hand side, as we just said, research, then there was this movement coming up from that group around Dr. Eric Kopp, Z Health, or Z Health actually. And in Europe, it was Lars Lienhardt with neuroathletic training. And there was people like Norman Deutsch, How the Brain Heals Itself, this incredible book. So it's my number one for somebody who wants to start reading about neuroplasticity. Norman Deutsch, How the Brain Heals Itself. So these people, and that's important for me for the webinar that we're sharing right now, they put it into action, how you can really practically change instantly things. So instantly you can recognize if somebody does have a neuro dysfunction. And that's something I want to show today, how you can test yourself and your clients. And then instantaneously, you can also have results if you have a different view on how the brain works. And that's something I really want to point out today. How does the brain work and how can we influence it?
So you have a couple slides to share with us, and then you have some demonstration and some participation that the participants can do today. So let's jump right in.
3 important words on the left side. Of course, neuroplasticity is something that we have heard, and I know that you had Angela Crowley here with a beautiful presentation about her work on neuroplasticity. Neuroplasticity basically means the neurosystem is plastic. It's like formable, it's movable, it's changeable. And if you look on the left side, neurogenesis means that we understand pretty well how the neurosystem receives the first education. So when you look at a baby, like I look at my granddaughter, Thea, who is now 8 months old, and I see how she goes through programmed steps of developing from a newborn that can't really, move a lot and doesn't have voluntary movement, that just has reflexes. And then you start turning to the side and going into prone and coming in quadruped. And now today she's standing and she's trying to walk. And this is what I want to illustrate with neurogenesis. So when you have a brain that has been, injured, or you have a toxicity in your blood, or you're lacking dopamine, or you're lacking another substance that your brain has a malfunction, we have to go back to these steps that we once did as a baby. So that's what neurogenesis wants to say. And there is a program we all know, BOBATH program. They put people back into baby's positions and they know what's important as the next step. Neurochemistry wants to say that, what you just mentioned, Brent, the dopamine, the serotonin, and these chemicals, they have to be present. And that's such a beautiful link to our meditation work, because when people are more quiet, when they're not stressed, when their autonomous nervous system is not in a fight and flight reaction, they're actually producing more useful chemicals for the brain to function. And so this is what I wanted to bring back into your mind, that we all were babies developing a neurosystem, that we all need these blood chemicals, and we all have the capacity to change. So if we just go one more, Melissa. These rules basically apply to neuroplasticity. And if you look at these rules, there is a distinct difference to musculoskeletal training. We are all coming from Pilates training. And of course, we know that Pilates is not only working on the body, but it's working on the mind. But I don't want to go through all of these 10 things, but what this illustrates is that the neurosystem can only rewire if it is used and addressed properly. Like if you say specificity, the number 3, if you lost a skill, let's say you lost the skill of proprioception in your left hip because of hip surgery, or you lost the skill, you lost the proprioception because of pain, because the pain has kind of like overwritten the proprioceptive normal input. You have to specifically address it and find that proprioception again. And these rules are basically applying to the nervous system in every state, either if we have a pathology or we are more or less, functioning normal. But do we function normal? That is the question. This is what I want to test with you. I think we probably could start that right away, Brent. So everybody gets up to seat and just tests if they function normal, because there is
even before we go there, Alex. I mean, you brought up my case, whether it was intentional or not, but it was my case of where. I lost control. I lost awareness. I lost proprioception in literally both lower extremities. And you were one of the first ones to identify it after I'd had the hip replaced. But for the last 2 months, you're talking about specificity and repetition. And in the Pilates and in, more importantly, motor control and motor learning theory, we talked about the idea of having... procedural learning and declarative learning, right? So the declarative learning is the mindfulness of it, like the really slow, painful part of getting the hip to be in the right position when you're loading it in standing. And, like so slow and so painful to think that I don't have it. And now after 2 months of really focusing on that detail and then going into procedural learning, which is practice, which Joseph Pilates talked a lot about. It's like our body awareness relies and demands practice of these movements to be able to maintain, because neuroplasticity works in 2 directions, right?
Right.
So I was having neuroplasticity related to pain and loss of proprioception and spiraling down, and then took the last 2 months off to refocus on specific organization, specific alignment, specific proprioception in the foot and in the ankle, in the hip, and repeating it all the time, multiple hours a day, to where now, for the first time in 10 months, I'm walking without pain and walking relatively normal. And these are the kind of things that I want to bring forward. That's why I wanted you to be here today, because you were also the one that identified a lot of these things with me when I was within Germany with you in February.
Exactly.
And so realizing how powerful this is. For me, it wasn't about neuromuscular strength. It wasn't. It was purely about neuroplasticity and reorganizing and really re-identifying where my body is in space in functional movement in a very slow, specific load matter with somebody's eyes on me. I couldn't have done it by myself.
Exactly. And it sounds complicated, but it's quite easy. And I want to do this with the audience here, so you can see how easy it is. But, before we change something, let's see where we are. So everybody at home, you can go in a testing stance with me. So I will just be standing here. And this is called the Romberg sign. It's a neuro test from doctors. It's an evidence-based test, or a test that is used. So just stand with your feet parallel, and let's imagine you have some disease that kind of like makes this already very complicated. But of course, like for somebody with a stroke, this would already be a challenge. But for you, it's easy. So stand with your feet parallel and close your eyes. Just close your eyes and see how much you have to balance with your eyes closed. So you have no visual control. You just have to rely on your proprioceptors. Okay. Then open your eyes and put one foot in front of the other. They don't have to be like really in one line. They can be a little bit to the side. But you are basically standing one foot in front of the other, and close your eyes again. How much does your system rely on visual information? So now your visual information is gone, you have your eyes closed, and you start to to get more feedback from other systems, from the balance system, from the feedback proprioceptive system. And basically, you should be able to stand here without falling. Okay? It's very easy testing. The Romberg sign. If you want to challenge yourself really a lot, oh, Brent, you're doing well. You put your feet like really in front of each other. You have a small stance and close your eyes again. And let's do one more test, and that's another standardized test. It's called the Underberg walking test. So have your arms out like this, and now you will start walking in place. And close your eyes, keep walking in place. And you have to do this for about a minute, but because of the webinar, we'll not really do that long. We'll just do like 30 seconds. Don't look, just walk in place. You are now again relying on your balanced vestibular system, on your auditory system, because you're listening to me and you have some orientation in space through audio. And you're relying on the feedback mechanisms from your feet and from your body. Now, stop walking, stop where you are. Don't look to the screen, just stop where you are and open your eyes. Have you turned away from your starting position? Brent, did you?
I did.
How much? How many degrees?
About 25 degrees.
Okay. So I turned also about 30 degrees. That's not really what we're looking for. Anything under 45 is not really a pathology, but you should basically be able to stand still. I mean, you and me are both, in a beautiful age. So our nervous system has already degraded a little bit, but we compensate so well because of all the other things we can do. So these two tests are very simple to do. If you have somebody that is showing instability and is turning a lot in space, what you know is that the nervous system does not really function 100%. And of course, then the question is, what can we do? And that's something I want to show you as well. But I just wanted to make sure that you have an idea of how the neuro system actually can be tested.
And I was going to say, Alex, like even a month ago, I couldn't have done that.
Exactly.
There's no way I could have done it. I couldn't have stand in tandem.
Yeah, yeah. And I loved when I was listening to you and Juan last week to the webinar about the feet, the power of lower extremity, where you talked about barefoot walking or getting stimulus into the feet. So it's all about stimulus. And that's something that, Melissa, if you can go one more slide and bring the presentation up, that's something where I want everybody in this webinar now take you into a paradigm shift. This is how the brain, let's say from the history of the brain centers that we're using has been deriving. The center brain, or we also call the reptilian brain, is the old brain. It's the survival brain. Then there is the rational, the cognitive, the motor skill brain, which is the cortex, and it's very superficial. In between, we have what we call emotional brain. It's also part of the old brain, but it is the gate barrier between our voluntary will, like movement, and our survival mechanisms.
Would we refer to that as limbic? Is that also limbic?
Limbic is, yes, exactly. It's a part of the emotional brain, right? So when you are giving somebody a task, that task has to pass and cross the gate of the oldest part of the brain. The brain will ask, is this task safe? That's the first question that the brain will ask. If you say, let's do a roll-up exercise on the floor or wherever, and you can show it to somebody sees the movement, you explain the movement, the person will think, okay, let's try it. That looks a little bit difficult, but I can manage. But the old brain and the emotional brain is asking, is it safe? The emotional brain is asking another question. Is this something I want to do? Does this have meaning for me? And on that level of subconscious communication, somebody is trying to do a roll-up. But if you have an environment that makes people unsafe, or if they have a life situation that makes them feel unsafe, they're in a survival mode, or they're unhappy, which is, of course, also affecting the dopamine level, the movement will alter. Okay? So we have to go into paradigm shift and say, movement does not come, or a movement exercise is not really generated as a strategy purely by the cortex, by the cognitive brain. It is actually influenced a lot by emotional and survival mechanisms. And the paradigm shift here is that all of the information that comes into our body is actually serving the task. And if we increase the information and if we lower the threat, then the exercise roll-up, for example, will be performed much better without even training it, without even looking at the motor skill itself. You just lower the threat and you increase the feedback into the body and the input, and this will alter the capacity to do the exercise more correctly or more effectively.
Yeah. And we see this over and over again, often without identifying what you just mentioned, Alex. Like in the Pilates environment, somebody having trouble with roll up, or it feels scary to them, or they have a belief of old back injuries, or they feel weak, or they have other different beliefs that are interfering with their strategy. We create an assisted environment with the Taoist springs. It's the same movement. And all of a sudden they feel safe. They learn the movement. You take the doll away, they're able to do the movement independently. So we often talk about, creating that successful movement experience that either exceeds their expectation or without pain, whatever they're dealing with. And this is that emotional area. And we see that over and over again, that this comes a lot from the pain literature too, right? Where it's like pain doesn't predict tissue damage, but it is a very primitive part of that primitive brain. This job is to make sure that we pay attention to things that potentially could hurt us or that are a potential threat to us. So something comes in from our body and the brain's asking, is this okay? Is there a problem? And historic brain, that parietal lobe and the primitive brain are like, yeah, don't you remember you sprained your ankle hiking in the mountains a couple of years ago and how bad that was? And it might be that bad, it might not be that bad, but that historical has just as much influence on the motor control of that movement as the motor cortex itself. More, because the motor cortex will be inhibited because of the perception in that limbic system and in the reptilian brain.
Yes, you're so right, Brent. I said instantaneous changes, right? Let's do an instantaneous change on a skill from the Pilates field. I have a scar here on my wrist. I also have a scar here on my foot from an injury. If you have a scar back home that you could now apply a technique to that I'm showing to you, please do that. If you don't have a scar, we will do something else. What I want to show with this is how immediate, instantaneous the change on the motor system can be if you increase the information flow in the system and when you decrease the threat to somebody. Okay? So if you have a scar, we will use it as a testing mechanism. But first of all, let's try a standing roll down. Okay? We will assess the standing roll down. And basically, you all know your standing roll downs, but let's see how far you can roll right now. So you stand up and you roll all the way down. Remember how far you can roll down. That's number one. Second, remember how it feels to roll down. Maybe there's a tightness or a pain. Now take the scar that you have on your body. And if you don't have a scar, take a painful spot on your body and rub it. Just rub it with your hand. The scar can be anywhere. It doesn't matter if it's in the area that is important for the standing roll down. I take my wrist. Just rub it. What that does is I increase the information that is not traveling in the scar. The tissue is more numb, right? Less information. I increase the information for my system. Okay? Good. If you don't have a scar, you just work on your pain area. Okay? But you have to do it like for half a minute, just stimulating by rubbing. And this is increasing information that comes from the area that is basically not sending information. Now go back into your standing roll down position and roll down one more time. I would love to see in the chat how many changes, instantaneous changes we had here. If you have a change, just go thumb up.
So I went from fingertips to heel of the hand.
Okay.
3-4 inches.
That's perfect. So how does that happen? And it's all the paradigm shift that I really want to put out there now today. And the paradigm shift is don't look at the output of your system if you want to see how well your body is working with the neuroplasticity. Look at the input of the system. So the movement and also pain, by the way, is output. Pain is not input. Pain is output. Pain is the expression of the activation of nociceptors, danger of damaged tissue damage. So go away from the movement that you see, come back to the information that your body has available to create that movement. Input. And it can be as simple as a scar. It also can be stress and threats. And I want to do a little technique with you where you can influence that also right away. And you see all of these techniques that I'm going to show you today are not Pilates exercises. They are exercises that come from those neuro freaks. They basically have researched, how many of these pathways can we stimulate in order to make an overall improvement of the result. Yeah, I see in the chat. I don't know how many thumbs up and how many reactions we have here, but just think about it. It's a very instantaneous little thing. So the technique that I want to do with you is palming your eyes. Okay, we all look at our screens all day long. Looking at the screen actually is not only having blue light in our brain, which makes us, especially when we want to go to rest and sleep, creates too much arousal, but also the light keeps and the things we see is distracting and keeps our brain so busy that we can't focus. So let's look at our rotation. Bring your arms out and rotate to one side. Then you can take the feeling, the sensation of rotation, or how much you can rotate and see out there. And now we are palming our eyes. So rub your hands and put your warm rubbed hands on your eyes. What happens now is you're taking away visual distress. So your body doesn't need to focus on things that it sees. You're basically going more into feeling. And there's a little bit of a flickering of light in the beginning for the first few seconds, and then it becomes dark, and then your brain can relax. This relaxation will result in a change in your motor system. Let's bring the hands down, open your eyes, and rotate again. Any increase? A little bit? Of course, this is very quick. I mean, when we do these techniques, we use a little bit more time because in one of the slides, the 10 rules of neuroplasticity, it says time matters. So the signal needs intensity and time to work on the brain and to work on the neurosystem.
I learned another one that was impressive and just like that. It was actually scrambling the eye. So like messing with the VOR, the vestibular ocular reflex. Like you would go into your rotation and you would, shuttle your eyes back and forth as fast as you could till you feel a little nauseous. But it literally disconnected you from that VOR. And then you would get a significant increase in your movement, because it was often how dependent we were on that visual stimulus that actually made our body rigid.
Right, exactly.
And just like what you did, removing that stimulus, the body could actually have a better expression of movement without the vestibular-ocular reflex.
Right, exactly. Vestibular-ocular reflex is quite important. Now, there's so many playthings today when you look at these things. So these look like sunglasses, but they actually have little holes in it. So they're also used in, I think, in Feldenkrais. So when you put them on, they look cool, but they also have these holes inside of it, so that your retina gets less light input into the system. And then your brain has to alter and kind of like jump from one side to the other, and that increases your sight. There is a play tool like this one here. And this is something where you can train your eye. It's basically letters. But you also can do something that I want to show to you as well. And it's called the eye push-up. The eye push-up is actually coming from neurocentric training, so from the Lars Lienhardt group. If you have something in your hand where you can see clearly a letter, for example, right? You can hold it in front of you. And then your eyes, the movement of your eyes basically will generate information that allows you to expand the information system, or the flow of information into your body through your eyes, through the visual system. So look at that thing that you have in your hand, and you can see a letter. Maybe it's a pen or something. And then go closer to your nose as far as you start blurring. You can't see really well that letter anymore. Closer to your nose tip. And then wait there. So your body has to adapt to that stimulation. So your eyes will adduct and then slowly go away. This is what we call the eye push-up. So 3 times, coming close to the nose tip until it blurs. Stay there for 10 seconds. And then go away again. The eye push-up. The eye push-up is training your eyes to function better. Why is that important? If I am doing a roll-up exercise and my visual information is reduced because of my eyesight, I will have a negative effect on the movement skill that I'm practicing, because I am relying on too little information, or it is a potential threat to me because I don't know where I am in space. So just try with your Pilates clients an eye push-up before they do an exercise that seems to be complicated or difficult for them, that they have a hard time practicing, and see if that eye push-up improves that exercise. And if it does, you have to give them exercises to improve their visual skills, which then will create more neuroplasticity.
I love that. And I think so often, I mean, like even me, I get dependent on glasses for things that I'm looking at, screen time. And Lizette is very adamant, my wife, about not conforming to the glass wearing world. Like she really resists it, even though she needs it at times. And she's looked up a lot of these kind of exercises, and we think, why wouldn't we be able to exercise our eyes and the interpretation of what the light is coming into our eyes? And just like anything, it could be just neuroplastic. It's the same exact thing as, learning a movement or learning to refine things. So I do appreciate that. And I think that the nervous system, there's so much carryover that we see, especially regarding senses. So today, talk a little bit more even about how you're using different senses. Like today, we've used proprioception in the feet. We've used vision. We've removed vision. You talked about hearing, like we could hear your voice when our eyes were closed. And it was at least giving us information of how far away did I start wandering from the speaker on the computer when I was marching in place, So right. Talk a little bit more about how you're using, the sensory input like you're doing? Like, what's the mechanism that is actually impacting our teaching of movement and impacting the quality of acquiring movement?
Well, I think, let me give you one example. Today I saw a patient. She came to me and said she was diagnosed with Guillain-Barré syndrome, which is this quite strong, slow paralyzing effect of like a sense. She was wondering if we can do something with our skills, so Pilates or osteopathy or anything. What she was worried about was the stability of her gait, because she had a hard time walking stable. I did the test that I just did with you, so the Romberg sign and the walking in place one, and she had a hard time to close her eyes at all. And she used to come to, like, she's a client of the studio. She has been in our Pilates classes for 20 years, I know. So when I realized that her neurosystem was damaged, I immediately moved away from her focus of attention, which is the legs and the balance, and moved into the other systems. So I worked on her audio system by doing this clicking exercise. I think I did this once with you. So somebody has eyes closed and you click, and they have to point with their finger, with their eyes closed, to where that sound comes from. If they are wrong, they open their eyes and they redirect their finger. They align it with the source of the clicking. Their brain is learning what the audio system is teaching again. And then I worked with her eyes. I worked with the ocular reflex and all of these things. I worked with her eyes. I worked with her audio system. And then I made her walk again. And the stability changed tremendously. She still has this diagnosis, but I was helping her system to be more complete, to handle the diagnosis. I didn't, heal the Guillain-Barré syndrome, but I definitely enabled her to have a better participation in her daily skills. So to me, the most important point is that the Pilates community takes away the message that it is okay to realize that there are other systems that are so powerful. And if we don't stimulate them, we will not have the best results. Let's stimulate the other system. I have here a little massage thing that we use in neuro training. And if you push it, it just vibrates. So if somebody has an issue with shoulder mobility, I put this on their arm and I just give it a vibrational massage in order to stimulate the receptors. And then I do something like goalpost. If you do goalpost testing, I can already feel my left arm now having more external rotation after just doing this, right? So that's what I want everybody to take away, that these tests that we're doing, they're testing the musculoskeletal system with ignoring a little bit the importance of the neuro input system. Has that helped? Does that answer your question, Brent?
Yes, thank you.
Okay. And if I may, I will go deeper into that practical application. And if there's something in the chat that people don't understand, because it's quite another kind of like approach now to movement and to Pilates, right? And to pain, for example, also. Input and output. Let's change that and let's work on the systems instead of a skill.
I love the idea of focusing on the input versus the output. And I think so often our verbal cueing and our tactile cueing are being driven by output, not by input. And when we can shift gears a little bit of how information is being processed, especially when somebody has a serious pathology or has a movement threatening belief, a movement fear of pain. We talk about in the principles, we get down to where we're looking at mobilities being limited. Is this a structural or strategic limitation? And, one of the things we don't realize is how complex we are. There's something as simple as a vibratory stimulus, auditory stimulus, visual stimulus, or even decreasing visual stimulus, right? Most of us that have proprioceptive challenges, we use our eyes to substitute. So when you're in a dark area or it's nighttime, those people have a much greater propensity to have trip and fall accidents.
Yeah.
Right? Because they're relying so heavily on their vision. And sometimes I would suggest when we're training our clients with things is do exactly what you were just showing, Alex, is have them, if it's safe, right, keep them safe, but close their eyes while they're doing some of the standing work or on the chair. They're getting all this proprioceptive feedback, and you take their eyes away, they have to rely on sensory and sound and other things. And even a little bit of increase of secondary and tertiary sensory input can make all the difference in the output. Like it can make the exercise and the movement so much easier for them versus them being completely dependent. And this is, and I'm speaking for myself these last number of months, but really becoming so dependent on a cane and so dependent on a belief that I was not going to be able to walk again. It's like there's things like that are so limiting, and then creating these little tiny movement experiences. And Feldenkrais is what I've been doing a lot of with Angela, and I was doing a little bit with you, was really what gave me that sense of new internal perspective, new internal awareness, and really thinking of where is my input coming from? Was my input coming from the fear of not being able to walk? Was the input coming from the pain that I was perceiving in my leg? Was the input coming, so it's like, and then seeing my output look like a handicapped, disabled 60-year-old man.
Exactly. Yeah.
And I wasn't. I'm not.
And that's not you. That's not you.
Me. It's not me.
Exactly.
And it took so many positive movement experiences to be able to break through that, but it included so much of what you're talking about today, Alex. And of course, it's just so everybody knows, as soon as this happened, I went to Germany, and part of the reason why I went there was not because I wanted to go to Germany, it was because I wanted to see Alex, because I was really struggling with some movement impairments after I had my hip replaced. And so we sort of started that dialogue of looking at the foot and looking at the back and looking at other parts of the body. And more importantly, what was going on inside my head? Like, what was I believing? Juan Nieto was, the same thing. So it's like, here I am, an authority on writing about this, on teaching it, on practicing with others. But when it was inside my body and inside my head, I really needed the practitioner to apply these concepts that you're talking about, Alex, to be able to break through. And now it seems very clear. Now it makes a lot of sense, but it didn't make sense when I was in it. It didn't make sense at all while I was in it.
Because it was like a life threat. Your system was working with the old reptilian brain, really being anxious. And may I say so, Brent, you look 10 years younger now, after having the capacity to feel that body in its totality again, and to take away that burden of, being restricted in everything. Yeah.
It's been pretty remarkable. And just even having, 2 months where, I just dedicated as much time as I could to reconnecting self, meditation, nature, working out, gyrotonic with Angela Crowley, Feldenkrais, doing my own medical care, meeting with doctors, figuring things out, and having that time to work through it. And it's like all of a sudden, 3 weeks ago, is like a major breakthrough, and I've only gone one direction. So, it's like I was going down the spiral of thinking that I needed more surgery. I was going down the spiral that I needed more medication. I was going down the spiral of believing, like, how am I going to be Brent Anderson walking with a cane and, teaching? Like, I know that's okay if that's what has to happen with me, but it was so hard for me to process emotionally and neurologically. And so is why this is so interesting to me now, of realizing, like, yes, I teach it, I understand on paper, but now I'm wondering, like, how do we really impact our patients and clients that get stuck in these areas with something as simple as what you're talking about, Alex?
Yeah, it's quite simple if you look at it, and it's quite complicated to let it like move through your system and really do it. So when you say the handicapped and the disabled people and things like that, I mean that's what we want to help these people and we want to get rid of the pains and
Change their
everything.
paradigm.
Yeah, to me, it's more important to look at everybody, and start looking at that neuro system before it is developing a pathology. So if you put your 35-year-old clients, and even if you just were in a med group, you know, put them in this testing and say, you know, stand with your feet in line and just close your eyes and see how you're doing. And you can see that the nervous system is crying for help, screaming for help. And we are not aware of that because we're always compensating. So I would love to see the younger generation and, you know, us, the young, old generation, to take advantage of these things and practice movement. Just what, you know, Juanito said and what Angela Crowley and all these beautiful people say, practice the movement from a more complete and complex perspective, and don't just go along recipes and, you know, the exercise has to be like that. I mean, it's all about this. And I think we can really change the health in the neurosystem if we act early on. But we can look at one more slide, Melissa. I think the neurochemicals slide is still up. And I think that's particularly interesting. If you think of the neurochemicals, I mean, we all know endorphins, the happiness hormone. So, of course, if we have a movement routine, endorphins are released into the blood flow. Oxytocin is the hormone of we also say the cuddling hormone or the relationship hormone, right? So if we feel lonely, we have a reduced release of oxytocin. And loneliness, again, one of those things that I talk a lot with my daughter as a psychologist researcher about. Loneliness is a problem in today's society. So if you have people that don't move, let's say low endorphin level, that don't cuddle or don't socially deeply relate, oxytocin level, that are in fear, which lowers the serotonin level, then all of these things will have a negative impact on our neurosystem. And I think that's so important to understand that our daily life shapes our neuroplasticity, right?
You know, there's so much good research coming out too now, Alex. I remember Lustig, Dr. Lustig talked about serotonin being the satisfaction neuropeptide and dopamine being one more of pleasure. Huberman talks more about it as motivation, right? Dopamine is motivation. Like we get motivated and we have a big release of the dopamine, but as soon as we achieve it, the dopamine goes away. And so people that live off of only dopamine are more prone to addiction, actually, where serotonin is more satisfaction. And what I think happens with us, and particularly in the Polestar family, like when we're practicing and we're with people, everything that you just talked about of, you know, a sense of safety, a sense of touch, a sense of belonging, connectedness, motivation in goals and the dopamine, a sense of satisfaction by creating positive movement experiences. And I would dare to say, you know, we get so caught up in the biomechanics and the strength or the control or the organization of it as reasons why we have so much success, right? It's very easy for us to justify an old science of why we're having success. But as we refine the information coming out now, I wouldn't be surprised at all, Alex, if we find almost everything that we see as a benefit from the work we do, doesn't matter if it's Pilates or gyrotonic or yoga, is based on the psychosocial interactions that we create, these positive movement experiences, the sense of connectedness, the sense of internal locus of control, the ability to have an internal awareness of their being, that we create those automatically. And a lot of times we don't even know it, but by them successfully progressing through a series of exercises that they didn't believe they could do when they came in, it hits all those targets. It's not about strengthening the transverse abdominis or the pelvic floor or the adductor. It's about the fact that they had this successful experience with you as a teacher, in a community, in a class. And I think we're going to see a lot more of this, Alex, as far as why we get successful outcomes. And I wanted to share one study, and now we got some questions and you got some more things to say. The study with Don Marie Ikes and Peggy Roller, where they looked at people that had high risk of falls. Very powerful study. They had 93 subjects that all had been to the hospital for a major fall 6 months prior as the inclusion criteria. All they did was normal Pilates in a class setting with a Pilates teacher that was skilled in Pilates, no falls training, no falls prevention, just successful movement classes. And the null hypothesis on that was that there would be no significant change in their risk of falls or fear of falls measurement. And the result of it was exactly the opposite. They not only decreased in their risk of falls or fear of falls measurements, they came out of the category. And not only did they come out of the category, they stayed out for 6 months post, was when the last measurement was done. So you're getting like this incredible power in a study that was just having a socialized positive movement experience that almost completely removed their fear of falling and decreased their risk of falling, because that's what it's associated with. And I think we're going to see more things like that. I hope the more new studies coming out are looking at what Samia would pose the question to us of loneliness.
Yeah.
So if somebody now has a social structure, do they get the same neurological and outcome measurement as somebody that's doing a, social group?
Yeah.
Like, how do we start seeing some of those things and being sure that if we're able to facilitate that in our facility, we're going to have a higher sense of accomplishments and still be affecting the physiological part of the system because of that. Right?
You're so right. You're so right. And talking about Samia, this MPI study that they did, they looked at the development and the growth of gray brain mass in contrast to white. So gray matter, the concentration of dendrites in the brain mass is making it grayer. So if the brain is more gray or grayer, there's more capacity. And they looked at how can we stimulate the growth. And there was a group of people over 60. And there were two tasks that they were teaching them. One was a new movement experience in a group exercise. And the other group had to learn a foreign language. And there was a third group where they had foreign language and new movement experience combined. They did this for 6 months. And I'm not sure if it's 6 or 12, but they did it for a longer time. So it's again this time stimulation that it has to really work for. And then they looked at the amount of gray cells that they found. And what is the group that had the best result? It's the movement group that also learned a foreign language. But when you say community, or I don't know, they had a very nice expression for that. They did these exercises in a group. So they also met each other. There was maybe the component of being less lonely, or so this is the motivational factor. This is what releases hormones in our system. And I agree, we will find out a lot of very interesting things in the future. And all of them will shine a light in the black box of, how does that movement come out of my body? And how can I shine a light in it?
That's so good, Alex. We got a couple questions real quick, and a couple of them need some clarification before we close down and make some announcements of some upcoming courses. Sarah Edwards asked if the eye push-up would be helpful for patients suffering from strokes. Thoughts on that? I would assume yes.
Wonderful. Yes.
Yeah.
Do eye push-ups with your stroke patients? Do eye push-ups with your ACL reconstructions? go away from the area of weakness, go to the system.
Yeah, love it. Maggie Reeves says, where can we get that product? And I'm not sure which product. The next one is a shoulder massager. And Charles, I would just say that any vibrator tool that is used in therapy where we have little massagers, there's a whole bunch of them, but it is the vibratory, it's the vibration that is stimulating the tissues. And there is a lot of science on what frequency and those kind of things. You can look into that. Yeah. And then the last question, Julie Buckland says, with the letter I test, are you asking the eyes to focus on the letter when the letter is close to the nose, or allowing the eyes to focus to remain blurry? You want it to try to focus, right? As it comes in.
Yeah, you're focusing. You're focusing, and before it gets really blurry, that's where you stop. Because then your eye muscles start adducting, and you're kind of like working on this capacity of adducting and focusing more precisely.
Yeah. Good. Yeah. There was a question from Oksana, and this is just a real important one. Oxytocin is a hormone that comes out of the pituitary gland in the brain, and it provides things like stimulation of sex hormones and a lot of other hormones in the body that sort of have to do with relationships. And it has no relationship to Oxycontin or oxycodone. So oxycodone is a synthetic heroin or morphine that is used for chronic pain and has been a horrible drug. Do not confuse those two. Oxytocin is a very natural, beautiful hormone that the body produces and is necessary for us to be healthy. And Oxycontin is a horrible synthetic drug that has killed millions and millions of people. And Purdue should be completely abolished from the planet for producing such a horrible product. So just make sure we don't confuse those two.
Okay. Let's cuddle more and take less drugs.
Yes. Alex, thank you so much. And you have so much information. We do want to let everybody know that in the fall, Alex has been working very hard at revamping a whole new course that is going to be focusing on neuroplasticity, neurorehabilitation. And when we say neurorehabilitation, we're not talking about just patients with neurological problems. We're talking that everybody has a nervous system. And every problem, every painful syndrome, every ACL tear is a neurological problem that needs neurological rehabilitation. So this really is for anybody that wants to work with human beings that have a nervous system, is what this course is going to be focusing on. And I learned a long time ago, we used to refer to ourselves as ortho heads in the physical therapy world because we wanted to work with orthopedic problems, right? And what we realized, and I was asked one year when I was doing my PhD to teach the neurorehabilitation course. And I was like, neuro? Like, no way. It was the best because it resonated with exactly what we do in the Pilates environment, how we create these experiences, and things like proprioceptive neuromuscular facilitation or bow bath, or the things that Alex talked about earlier. You know, these are powerful tools for restoring movement, and we are the movement professionals. And if we don't understand the nervous system and we don't understand neuroplasticity, we're missing so much and so many tools that can help us with all of our clients, both from a prevention and wellness standpoint to working with very severe pathology. So we're looking forward to that class, Alex. We know the course is coming. It'll be accredited. It'll be a CEU course. We'll be advertising it like crazy. We're looking for a fall start, right? And that'll be really exciting. I had one other announcement. I know I'm a minute over time. I decided sort of last minute to focus on two really powerful workshops that we're going to offer as part of a summer program. And you, as the attendees of the Pilates Hour and So Faithful, one of them is going to be looking at stenosis and looking at the myth and science of stenosis, looking at, and me particularly sort of working through this recently. It's very fresh in my mind, but I want to take 3 hours with you and be able to dive deep into how we work with it, the understanding that everybody in an X-ray over the age of 50 has stenosis. That does not mean that they have stenotic symptoms. It means that our body is getting older. It's normal, sort of like a wrinkle on our skin. And I want to be able to talk about that and give tools, sort of like what Alex did today. We don't have to get stuck in thinking that everything has to be surgery or everything has to be pharmaceutical. So we're going to talk a lot about that. The second workshop is a 3-hour workshop, really looking at the foot and ankle and looking at it as the information source to us as bipedal animals. And we're going to break down the biomechanics. We're going to do a lot of functional tasks and activities during the course. And we're going to get that price down really, really low so that everybody can participate in it. And there will be live online courses happening on July, I forget the exact date, and I think the Saturday. So we're making it so all of our European followers can be with us that day. And then it's going to also be on August 17th, I think. Same thing, so people can be with us on these workshops. And then we have these wonderful courses that are starting in the fall. Alex is being one of those. So we hope that you have been stimulated today. I certainly have. And we look forward to seeing you all soon. Alex, thank you again. Congratulations with your daughter and Leon. It's beautiful pictures that I saw.
Thank
and
you.
Above all things, everybody, be kind and bring the world physical, emotional, and spiritual alignment. Thank you so much.